giving your ribs room is important. Now, I'm not saying let's go burn our bras, it's 1960. Hello to all of you beautiful birthing people. Welcome back to my channel. My name is Elizabeth, also known as Nurse Sabe here on YouTube, Instagram, TikTok, and I am a labor and delivery nurse, postpartum nurse, certified childbirth educator, and today I wanted to come to you guys with 5 easy hacks to have a better, and by better I mean more comfortable, faster, easier end of your pregnancy and birth. These are hacks that you can easily take into your everyday life, add them into your routine, and they are going to make a huge difference in helping your baby be born. So if you've got any hacks to share from your birth or things that you've heard, definitely leave them down below, and don't forget to subscribe and give this video a thumbs up because that just helps with the algorithm to get these hacks out to more people. So without further ado, let's go ahead and jump into it. So the first hack, the first thing that we can do towards the end of pregnancy to help support getting baby in the best position possible, which will in turn make your labor easier and faster, is focusing on posture. And I'm not just talking about when you're up and moving. The posture that I'm talking about is more when we are relaxed, when we are lounging on the couch after a hard day's work, when we're sitting in our office chair, when we're sitting in the car. All of the ways that we sit more comfortably is more of like a bucket seating. So if you're in the car, you're kind of like leaning back and slouched over. Your knees maybe are up above your hips and you're kind of in a curved like C position. What that can do is actually encourage your baby to be in OP or sunny side up position, which can increase the diameter of the head that we're having to push out and just in general make labor more uncomfortable. We could experience back labor, coupling contractions. So our goal is to have baby rotated at the beginning of labor to be on the left side and facing your hip, and then rotate this way during labor. So really having good posture can help with that. First thing that I want you to focus on doing when you're sitting at your seat at work, when you are sitting on the couch, when you are driving, is actually sitting up on your sits bones. Those are the bones that we actually can open when we do our knees together, feet apart. Those are the bones of the pelvic outlet. If you put your hands under your bottom right now, you can feel those bones. And you can feel if you lean back, you are more sitting on your sacrum and not sitting on those bones. We want that sacrum to be able to move, and we want those sits bones to support us. So sitting forward is the very first thing that you can do. Now, obviously, this can be difficult. We've got the weight of the pregnancy, and maybe at work you want to be in a more lounged position. In that case, I encourage you, instead of lounging backwards, you can lounge forward. And again, that can help to rotate baby into that more OA position, or with the back of their head facing out, which is our ideal and our goal. Some other things that you can do when you are resting, if you do want to be lounging and reclining, is lie down on one side or the other and have your knees and your feet fully supported by pillows. A birth ball is another great option that we can do. But the big thing with a birth ball is that they have to be properly sized. If you're sitting on a birth ball that's too small and your knees are up above your hips, you're gonna be in that same position that we're trying to avoid. So we want your hips to be slightly above your knees, everything to be semi at a right degree angle with the knees to the ground. We want the birth ball to be fully inflated, and we want you to be able to sit up on those sits bones and rock and move around. Some other positions that can be really great for helping baby get into a good position and can be alternatives if you're feeling like you want to lounge is actually kneeling on the ground and leaning over a birth ball or leaning over the couch. You can even kind of focus on having a greater than 90-degree angle between your baby bump and your legs when you're in that position. And so what that does is give baby plenty of room to rotate, and it also allows gravity to help pull the heaviest part of the baby, aka the back, and rotate it this way, which is kind of our goal for labor. So this is why when people are experiencing that nesting urge at the end of pregnancy and they're like, oh my gosh, I want to be on my hands and knees scrubbing the floor, I totally encourage that because I think that can be a great way to help get baby in a really good position. Now, you don't want to exhaust yourself, but you do want to kind of focus on getting in positions that help baby be in the best positions. Now, the next thing I'm going to talk about is something that seems maybe a little bit kooky, but I want you to change how you're wearing a bra. These are my pre-pregnancy bras. They are granted super old, Victoria's Secret. I don't even know that these are made anymore, but they are underwire and they have a pretty tight band. When you get pregnant, there is an increase in the size of your uterus. Duh, the baby's growing in there. And that increases pressure. If you are wearing a really tight bra with the band that's really tight because you haven't gone up in a band size, or if you're wearing underwire, something that's really restrictive on that rib cage, it doesn't allow your body to adjust to that increased pressure in the way that it normally would. Your body adjusts to that increased pressure by kind of evenly distributing it between the pelvic floor, the abdominal muscles, and the ribs. So your ribs really need to be able to expand and give room to that growing belly. And if they don't, because you're wearing that really tight bra, that can do a few things. That can make baby be more likely to be on the right side versus the left side, which can cause issues with baby then turning to that OP position in labor. It also can put more pressure on your abdomen and increase diastasis recti, which is that separation of the abdominal muscles. It also can put more pressure on the pelvic floor, which can lead to tension and pain and difficulty with baby rotating and descending. So really giving your ribs room is important. Now, I do want you to be comfortable. I understand I don't have the biggest boobs in the world. So like, do what you need to do to get by. I'm not saying, let's go burn our bras, it's 1960. What I am saying is limiting your bra use at home, getting a bra that fits you during your pregnancy. I know it sucks to have an extra expense, but getting one that doesn't have underwire potentially, but also just has a bigger band size so that it gives those ribs place to expand. And then when you are in labor, I really encourage you to labor bra-free, or with a really soft and loose sleeping bra or nursing tank, or you could even take like a t-shirt and cut it off or something like that, just to give those ribs room to expand. Because if we give the ribs room to fully expand, then the diaphragm can fully expand. Everything will help with that baby to rotate, descend, and then dilate your cervix and lead to an easier and faster birth. Kind of what I like to think of is like back in caveman days, what would we be doing? How would we be doing our posture? How would we be doing our hunting and gathering? How would we be doing the bra thing? We wouldn't have a bra. But let's cycle it back to modern day, lovely modern medicine that is life-saving potentially if we need it, and then meet those two in the middle. So speaking of how we are encouraging baby to get into a really good position when we are in labor, the next thing that we can do to help encourage baby to be in a really good position is to make sure that we are not tensing up our bodies. When we tense up our bodies, that provides extra resistance that can make baby more likely to be malpositioned. It can also increase the pain that we're experiencing with our contractions. So staying nice and relaxed is key, and keeping our vocal cords nice and relaxed, our jaw nice and relaxed, will help coincide with your pelvic floor. Because all of you right now with me, I want you to go really hard, clench your jaw. You can feel that clench all the way down into your pelvic floor, because those two things are connected. If you look at the vocal cords, if you look at the jaw, and if you look at the pelvic floor, they look very similar. They're totally connected. We have a few things that we can do to keep tension out of our jaw, out of our face, and help relax the pelvic floor. Breathing is gonna be your best go-to in labor. I have a video all about breathing. I really encourage that you watch that, and then I really encourage that you practice this breathing. I really encourage when you are on the toilet, when you are in traffic and feeling frustrated, when you're in any sort of pain, to practice this breathing so that it becomes second nature to you in labor, and that you practice it with a partner so that they can help encourage you when it's not becoming second nature. But one way, as things get more intense, that we can really make sure that that jaw and those vocal cords are nice and relaxed is horse-lipped breathing. I'm going to show you right now. You look absolutely ridiculous, but it really helps. So you take your nice deep breath in, and then for out, it's gonna keep you from tensing up those vocal cords, keep you from tensing up your jaw. You can't scream really high pitch, which would tense up the vocal cords. You can let out some noise, you can let out some emotion, and hey, it might even lighten the mood in the room. So horse lips are gonna be your helper. Another thing that's going to be your helper when we're trying to not be tense is the toilet. The toilet is a dilation station, because when we sit on the toilet, that is a place where we naturally relax our pelvic floor to pee and to poop. Now, sometimes when we sit on the toilet, it can make labor feel way more intense. So I encourage you, if that's the case, that when you're getting up and trying to pee every hour, that you go ahead and spend 3 to 5 contractions on the toilet every hour. Now, when you're on the toilet, your positioning does kind of matter. We want to have our feet flat on the ground. You can use a squatty potty or a stool. That can be beneficial, but those feet flat on the ground really help keep everything nice and relaxed. If you're up on your tiptoes, we have some more tension that can cause some tension in our pelvic floor. So feet nice and relaxed. You can face the toilet and lean over it with a pillow if you want to, or just sit the other way. But sitting on the toilet once an hour, trying to empty your bladder so that your bladder's not in the way of your baby's head getting down, and then 3 to 5 contractions of a nice relaxed pelvic floor are going to do wonders and dilate more quickly. The last tip or hack that I have for you is the comb hack. You guys know that this is one of my favorite hacks for labor ever. I give all of my patients a comb as soon as they walk onto the unit because it really does a whole world of good. So what you're going to do is you are going to take just a regular old barber's comb. They have these in the hospital, but you are more than welcome to bring your own as well because you can use it at home too. What we're going to do is utilize the gate control theory of pain. Basically, you have nerves all along your body. Those nerves then communicate with your spinal cord, which then communicates with your brain. Your brain has gates that open and close to let those pain impulses in. And so if we can get a pain or a sensation impulse to your brain faster or concurrent with the contraction, then we're kind of distracting your brain and your brain can't focus all of its attention on the pain of the contraction. So during a contraction, focusing on keeping everything else nice and loose, feet flat on the floor. We're sitting on the toilet, we're holding a comb, and we're squeezing to get all of those pressure impulses to our brain. Maybe we're doing some horse lips too. And hey, I'm also not wearing a bra and I'm sitting forward on my sits bones. All things that are going to be really beneficial in helping your labor progress faster, easier, and more smoothly. Let me know if you try out any of these hacks. Let me know if they worked for you in the past. And until next time, bye guys!